Hello doctors. What if I tell you, if you spend 40 minutes in your life, you will interpret ECG like a cardiologist? Yes, you heard right. This is a complete set of series for mastering the ECG like a pro. Okay, without wasting our time, let's get jump to it. Before going into detail, let's see a normal ECG graph and clear some basic concepts. Okay, the first question is, we have one heart and it produces single electrical activity during each cardiac cycle in normal person. But in the graph, how we get around 12 kinds of ECG waves? The answer is simple. Let's suppose heart is a celebrity and the fan members are ECG leads. Heart is standing in middle of the fan members. So each fan member could see the heart in different angle, like one can see the front of the face and the other can see the side of the face. Just like that, each of the lead perceive the electrical activity in the different angle. So we get the different kind of ECG waves. As we said about the leads, let's start with ECG leads. In this graph, we could see 3 bipolar limb leads, 3 augmented unipolar limb leads, and 6 chest leads. Let's see some important basics about ECG leads. First, circuit. Our body is a good conductor. When we connect both positive and negative end of the leads to the body, we make an electrical circuit. As ECG machine records the electrical activity of the heart, for our convenience, we can take this point as electrode placement, even though the actual electrode placed here. Axis. This is an imaginary line drawn between two leads, which is determined by the place of the electrode. If we place the electrode here, the axis will be like this. Pattern. Pattern means what ECG records in that particular lead. This is the place where you should understand the concept very well. Let's suppose electrode placed like this. So the axis of the lead will be like this. Let's bring up the knowledge from our previous video. Link on the description, or you could see the icon up here. The concept is, when the positive current moves towards the positive electrodes, the deflection will be positive. If the positive current moves towards the negative electrode, the deflection will be negative. Let's make it simpler. Imagine a medical student preparing for the exam. The positive electrode is the student's brain and the current is the subject which he is preparing for the exam. And the deflection will be how he feels after studying. So, if the subject that he is studying goes into his brain, he will feel positive or happy about the exam. If it goes opposite side, he will feel negative or scared. I hope now you understand it well. In some case, we can see the current flow perpendicular like this. It's a perfect example for pharmacology like subjects. At first, we will feel positive that we remembered everything in pharmacology. But the time goes on, the remember things also goes. As it goes away from the brain, he feel negative or scared about the exam. Next plane, heart is a 3-dimensional part. So, we see from the different plane. Bipolar and augmented unipolar limb leads reads the electrical activity from the frontal plane. And the chest leads reads the electrical activity from the horizontal plane. Hope you understand the basic concept well. See you on the next part of this series. If you like this video, do subscribe and share to everyone. Thank you.